Molecular breast imaging, or MBI, is a technology that our group at Mayo Clinic has been working on for, I think, over 10 years. And it's actually a nuclear medicine test. It relies on the functional uptake of a radiotracer. What happens is this tracer circulates throughout the body and it's taken up in cells that are more metabolically active. So cells that are rapidly changing and dividing will take up more of the tracer than normal cells. And that allows us to see breast cancer. And the most interesting part of that is that we can find cancers that you wouldn't see on a mammogram, because a mammogram doesn't give you the functional imaging. So the role for MBI is then to be, we think, would be a good supplemental imaging test for women who have a lot of fibroglandular tissue on their mammograms. So you might have heard of women who have dense breasts, means that they have more normal fibroglandular tissue, which can hide breast cancers. So we found in our studies to date that the MBI can uncover those cancers. What is happening more and more now that women are becoming more aware of dense breasts and the implications of having them, they're seeking out additional screening tests. So there's several tests that are being considered in practice. Some women get screening ultrasound. An MRI is an option, a magnetic resonance imaging scan, but that's very expensive. And at Mayo, we offer MBI. So we wanted to have some data to show, what we wanted to see was initially whether offering MBI would lead to a lot of additional false positives or additional biopsies that would then increase costs, but not in a good way. So in a way, we kind of wanted to see would the extra costs of additional screening be worth it? So basically, if you can detect a lot more cancers, it's worth it. And that's exactly what the study found, that even though it costs more to add a test and the workup that goes with that in additional biopsies, because we found so many more cancers, in the long run, we actually ended up saving costs by a little bit. So the cost per cancer detected was lower when we added MBI to a mammogram. And that wasn't found in other studies that added ultrasound or added MRI. In general, we think that MBI is a good trade-off in that it doesn't have a lot of additional costs, but it detects cancers that are important, and it detects cancers that are missed on mammography. Well, I think it's very important to consider the patient's perspective. If you're going to consider an additional test beyond your mammogram, you want to know that this isn't going to generate something that is just an extra biopsy or extra costs that basically weren't worth it. So this offers a good option. We think MBI has a very high likelihood of finding something that would be important. So that's good from the patient's perspective. And I think as far as providers, if they can communicate that to the patients, that if we have the data in hand so that they can communicate that to the patients, that's very helpful to them.